Hi everyone, welcome to ATP Live. Let me know whether you can hear me, whether you can see me, and I will try and also share the video to your friends and to everyone. I'm also going to do the same. And if you have any questions, feel free to drop them on the video you're watching, and then we'll be good to go. So just give us a few minutes so I can share the videos, and then we can get started. Thank you so much for joining me today. Yeah. So I'm just sharing the videos to our various platforms. Welcome everyone. Okay. Uh, yeah, let me go back. So if you're watching me on Ask the Pediatrician's Facebook group, you can drop your questions straight under in the group. But if you're watching me on ATP Family or ATP Still a Mom, you will have to drop your question. You have to click on the video to go to our page and drop your questions directly on the page, because that's the only way I'll be able to see your questions. But I'm just going to make sure I pin them to the right platform so that you can also. Welcome. Hope you've had a nice Monday so far. I think I'm going solo today. I may not have any moderator joining me, but it's okay. I'll be fine. Okay, I guess we're ready to go. Yeah, I can see those of you. Sorry, that's not what I want to show. Yeah, okay. I can see your comments. All right, so once again, now that I've done all the administration part, I want to welcome all of you to Ask the Pediatricians Live today, Monday, 22nd of November 2021. We are almost getting to the end of the year, and it's been quite an amazing time being here every Monday answering your questions. So welcome everyone. This program is brought to you by Ask the Pediatricians Foundation, and we are committed to the welfare and the health of all Nigerian children and all children globally. And one of the things we do is to create awareness, provide health education and information. And that is why we are here today to answer your questions. Of course, you know that even beyond this live program, you can always post your questions on our Ask the Pediatricians Facebook group, and from Monday to Saturday, and we answer your questions. We also have Ask the Family Physicians, ATP Family, also where you can ask adult health related questions. And we also have ATP Still a Mom for those who have suffered either the loss of a pregnancy or a child and they want some kind of emotional support or closure. So that's a support group for such parents. So these are our platforms on Facebook. Of course, we also are on Instagram, and we're also available on YouTube. We don't do question and answer sessions on Instagram and YouTube, but you can drop your questions on ATP Live, which also you can watch on Instagram and YouTube. And of course, we also have our ATP website, www.askthepediatricians.com, where you can always read topical articles. And now we're having very new articles every week. Yesterday was on malnutrition. So if you want to know about malnutrition, you can check our website. You can read. You can drop your questions on the website directly, or you can navigate your way to our group and drop your questions there. So that is all the announcements that I have for you. And then I'm going to start answering your questions now. I don't know, somebody say you are waiting backstage. I don't fish up. I'm able to take people onto live on Instagram. Sorry about that. Just drop your questions either directly or in the question box, and I will answer them. All right. Oh, that is okay. Thank you so much. And if you're on your Facebook group, I will not see your name unless you give StreamYard the permission to show your name. So if you are asking questions, make sure you don't break your questions into pieces. Make sure you put all your questions in one post. Try and keep it short and simple and straightforward to the point. If you want to ask about weight, please put the current weight, birth weight. If you want to ask any question about your child, please, it will be helpful for me to know the age of the child. So these are like housekeeping rules that will make us not to waste so much time asking you to hack. So try and make sure you start every question with the age of your child. Try and put, if it's about weight, make sure you put the current weight, and don't tell us all the life story of the child. Just go straight to the question you want to ask. Of course, you can put any relevant information that will make it easier for us to answer the question. If you have questions about rashes, without seeing the rashes, we cannot answer them. So it may be more useful for those who have such questions to put a picture and the question on the Facebook group instead. And I think that will be more helpful. So I hope all the housekeeping rules have been factored in. And if you join late, you can always watch the video again. You can watch past episodes and you can get answers to your questions from them as well. Okay, so the first question I got on Facebook is what causes greenish pool? Okay, so greenish pool in infants. So infants like children between the age of 1 month and 1 year. So the stool of children is affected by what they eat. So that's number one. So if a child is on exclusive breastfeeding, and that child is having greenish stools, it's most likely the child is not getting enough of the breast milk. So you need to make sure you are breastfeeding properly. And breastfeeding properly means that your baby is sucking the breast milk from morning till you're sucking the breast milk for like 10-20 minutes, and you're sucking both the fore milk and the hind milk as well. So that is what we expect in terms of a baby who is on breast milk. For babies who are not on breast milk, there are some formula that can actually make your babies have greenish stools, especially if they contain iron. That's number one. Also inadequate feeding, even with the formula, can also cause greenish stools. And if your baby is also on other food, like if your baby is eating vegetables like a wedu and all that, it can make the color of the stools to be green as well. Or even if you yourself you are eating such, it can, or the pigment from your food can also be passed into your baby's stool. So the one we worry about is the what we call, it tends to come out like a small, foamy, scanty, greenish stool. That is what we call starvation stool, and we tend to get that in children due to inadequate feeding. So I hope I've answered your question. The most important thing is not the color of the stool or the stool itself. The most important thing is that what is that information telling us, so that we can address it properly. Okay, so what causes bleeding gums? So there are many reasons why people can have bleeding gums. It's better you are very specific. I want to assume you're talking about children. So, and depending on the age of the child as well. For example, vitamin C deficiency can cause scurvy, and that can make you to have bleeding. Poor oral hygiene, like if you have what the dentists call periodontitis, that is inflammation around the gums. You will see that when you're brushing your teeth, blood can be coming out. So those are the other things. So if you have bleeding gums, it's better to see your dentist so that we're sure it is not it's not a gum or teeth problem. And then obviously if it is also like vitamin deficiency, you need to make sure you take vitamin C, eat a lot of fruits and vegetables and all that. So those are the things. Some people also who have bleeding problems can bleed from anywhere, and they can bleed from their gums as well. So I hope that's helpful. All right. My child had Penta 3 immunization and she has been vomiting. What should I do? Okay, Penta immunization does not cause vomiting. So if your child is vomiting, your child may be sick. The fact that your child has had the immunization today does not mean your child cannot be sick from other reasons that could make a child vomit. Immunization on its own usually will cause fever, usually sometimes it can cause swelling around the site of the injection and pain and all that, but vomiting is not a typical side effect of immunization. So if a child took immunization and is vomiting, I'm going to assume that child is ill from other reasons. That is just a coincidence at the same time of taking immunization. So, and there's really no first aid for vomiting. I know a lot of mothers always ask, what do I do? There's no first aid for vomiting. If your child is vomiting, if it's just once or twice, you can try and give them ORS just to make sure they replace what they are losing. But if they keep vomiting anything you give them, there is no other first aid. You have to take them to the hospital, because what we need to do is to admit the child and rehydrate the child. And unfortunately, sometimes when the children are dehydrated, they actually vomit more. So it's a kind of a vicious cycle. So what you need to do, please don't give your children Phenergan. Don't give them any medication because you are trying to stop vomiting. You are going to cause more problems for us. Just take them to the hospital. The most important thing is to rehydrate the child. And if we know the other causes of vomiting, you didn't say the age of this child, you didn't say what are you feeding the child with, any other thing that's a cause of vomiting, we try and address it. But the most important thing is to make sure the child is rehydrated first. All right. Thank you, Rosemary. Good evening, everybody. Agumai say, what can I use to clear itch rashes from my child's body? He has itch rashes on his back, neck, and his arms. I'm very wary of mothers telling me their children have itch rashes, because mothers always think all rashes are itch rashes and measles or chickenpox. No, it's not. So, and there are typical places where you find itch rashes. You tend to find itch rashes more on the neck, on the face, where you tend to sweat, or on the trunk. So your baby is having rashes on his arms, on his back, on his neck. I would rather really want to see these rashes, not to assume it's itch rashes. It's better to see a rash than no, because if it is itch rash, what you really need to do is to stop the child being exposed to it, and the rash will clear. So usually we say keep the child cool. If the weather is hot, don't overdress them. Don't put cap, socks, mittens in the hot weather. Just wear light cotton wears for them. Make sure your room is well ventilated, whether with fan or with the AC on. There's no problem with that. And so if you're doing that, give your child a cool bath. Cool bath is not cold water, it's not hot water, normal temperature water. And if you do that, so when the children are cool, they'll be the itch rashes will go away. Or you can even use some of the itch rashes powder as well, briefly, for that period, then it will clear. But if you have been doing all that and your baby is having rashes, please don't assume itch rashes, because it could be other kind of rashes, and you cannot, like Yoruba will say, you cannot use the drug for ringworm to cure leprosy. In other words, you have to know the right diagnosis to know the right treatment. So that's so when people say itch rashes, but the rashes are not going, it's most likely they are not itch rashes. They are something else. So it's always good to check it up. All right. Let me quickly go to Instagram and answer the Instagram paper. Yeah. Thank you. Lots of people on Instagram today. Okay. Thank you. Marka, welcome. Welcome everybody. I've seen the usual regulars Okay, Mina is saying good evening. Is walking on toes for an 11-month-old normal? So tiptoe walking is normal at that age. And we say it's normal for babies to tiptoe walk even up to 2 years because they are just learning to walk. But if your child is having is tiptoe walking by beyond 2 years, what we call persistent toe walking, there may be a problem. Some family it runs in the family for them to tiptoe walking, but sometimes it could be a sign of other neurological problem or developmental problem. That's from age of 2 years and above. And then we want you to see a pediatrician. But below 2 years, we will still take it as a normal thing. Thank you. Tola Torch Empire is saying my baby is 1 year, 7 months, and she has already shed weight and she is well. So Tola, you need to be very specific. So your baby has shed weight. What is the weight before? What is the weight now? And then that will be more useful for me to answer your question. And you have not actually asked any question again. You just say, and she is well. And again, my definition of eats well may not necessarily be your own definition of eats well. So I actually don't like parents telling me my child eats well. That is not very specific enough. I really want to know what does the child eat. Usually, if you miss me in my clinic, I will be asking what are the child eating in the last 24 hours. So we call what we call 24-hour food recall, and I want to put it down. And it's not just what the child has eaten, what quantity has the child been eating, and then we'll analyze that to know whether the child is actually eating well or not. So because it's not just for the fact child to be having something going through the mouth and their tummy being full, that is not eating well. For example, a child can eat 200 mils of pap 4 times a day and their tummy is full, but that is not eating well because the child has eaten only carbohydrates. We can't see protein there, no fat and oil, no fruits, no vegetables. So there must be a right mix of food, right quality, and also the right quantity. Then we can now, yeah. So if your child is eating well by our own standard, and then we look at the weight because sometimes a mother the other day was asking me that her child is losing weight and a 3-year-old is now weighing, I think, 14 kilos. No, I think it's a 2-year-old is weighing 14 kilos. She was worried because the child has lost weight from 17 kilos. And I was like, your child is actually still overweight because your child should actually be weighing 12 kilos. So I always want to know what weight. So sometimes parents say my child has lost weight and that child actually needs to lose weight because the child is overweight. So information is very, very specific. That's very, very objective. So you may, if you have that information, you can still repost your question before 7 p.m. and I will address it. Okay, show me for King. Show me for King is about most consistent Instagram ATP Live viewer. Thank you for always being here. Okay, good evening, doctors. Please, there sorry, is there food that trigger colic? Okay, there's ideally no food should be triggering colic. Oh, I guess what you meant is that what you as a mother eat can it cause your child to have colic? Because for your own child, the only food I want your baby to be eating at the age when they can have colic is only breast milk. So breast milk itself does not trigger colic. There are food that mothers can eat and it can affect their babies. If you know, it can make them fussy, especially all these uh, like flavors of some of those products we add to the food, like additives and all that, they can sometimes make babies very fussy. So, and it's very obvious. You will just notice that anytime you eat that particular thing, your baby tends to be fussy. Then you just stop it, and that's all. So, yeah. So if you notice that when you eat spicy food, your baby become fussy, then don't eat spicy food. It's as simple as that, you know. So I guess you noticed that, which is quite good observation. The Mama Balolua. Okay, is that Temitope Yusuf Adekunle? Oh, okay, that's our moderator. Okay. Oh, okay. Okay. Yes. Oh, okay. Temitope, you can come back. I think I mixed you up. I didn't. I think I mixed you up with somebody else. Okay, I didn't know you are the one moderating. Okay. No, Rookie may say thanks, Doc My baby started complementary feeds 3 weeks ago. He eats very well. Again, eats very well is a very subjective expression. So usually pediatricians don't like that expression. We want you to tell us what exactly your child is eating, because as I said, your own definition of eats well may not necessarily be our own definition of eats well. So for 2 days now, he has been grunting and passing like an index finger size of semi-solid pool. Okay, I mix more orange with water. It's okay. Just wanted to be sure this is normal. I seem a bit constipated. So, Rookie May, it will be nice for you to tell me the age of your child, and for you to tell me whether you are still breastfeeding, and for you to tell me whether you are still giving water, and exactly what food is this baby taking now. So those information are more relevant so that we can, because if your baby is 6 months old, just started complementary feeding, you should still be doing a lot more breastfeeding than solids. So for that, this baby needs to only take like porridge kind of food twice a day, and the rest of the child's food should still be breast milk. And of course, you can give water. It's okay to give orange, it has to be diluted. So those are the things your baby should be given, and then that your baby will not be constipated. So we need to be sure you are doing the right thing, I hope. So if you have more information, you can also put it. Okay, can I allow my 4 month old baby stand on my laps? No, we don't want a 4 month old standing. We want a 4 month old to have neck control and then maybe begin to sit, usually by 5 months, sitting with support, but not definitely not standing. Ugo say, is there any implication of eating spicy food, especially for children? There's no problem. We spicy food are not calorie. For children, what we want them to have is calories. We want them to have protein. We want them to have vitamins, minerals. They don't necessarily need to eat spicy food to get those things. And so I know that some of us have culture where we believe that we have to eat things that are very spicy. And sometimes children actually don't like spicy food, and there's really no need for you to give to them. So some people believe that your children must eat, like I'm from Yoruba culture, and Yoruba will say, if you don't eat pepper, you are not eating well. So, but really, pepper is not calories, doesn't add anything to children. So you can give your children food without pepper at all, and it's perfectly fine. I'd rather you give them vegetables. They can eat their wedu. You don't need to add pepper to it. You can add the crayfish. You can give them fish. You can give them meat. So, of course, some of us, because it's a cultural thing, you want your children to also learn to eat spicy food. But try and make it moderate or mild. There's no point punishing those children and not making them to have what we call food aversion. In other words, children don't want to eat because it's too peppery, it's too spicy, and then you're actually losing out at the end of the day because they will not even eat at all. It's better let them eat less spicy food but nutritious and something again that they love, rather than so that's where creativity comes into feeding our children. So spicy food is not essential for having a good nutritious food. So if your child is a child that some children likes it, but some children don't like it at all, so just don't give them spicy food and make them cry and have watery eyes. Is not really worth it. Okay. Jofisi Enterprises say, please can I take lemon, honey, cucumber, minced leaf? Oh my goodness. Only you for weight. Okay, so my default position, if you are breastfeeding, it's not the time to do weight loss. It's not the time to start. You can do weight loss in the sense of you can eat sensibly, you can do exercise, but it's not the time to start taking all this concoction for weight loss supplements or herbs, we don't recommend it. Can imagine you taking all these things, your baby is going to be fussy, your baby is going to affect your baby, because some babies will be sensitive to some of these things you are taking. So, and some of you, if you read some of those products, they will always write it on it. It's not for breastfeeding mothers. So most of them always write on it. So please, this is not the time to lose weight, to start taking weight loss supplement. That's what I mean. I'm not saying you should remain, I'm not saying you should not get back into shape, but we don't want you to do it because you want to start taking supplements or products that are for weight loss. You can reduce your food intake, you can make sure you exercise. Even your food intake, you still need to eat you see to eat the average that you will need for you to lactate, so that your breastfeeding will not reduce. So what we want you to do is eat normally, eat healthy, lots of fruits, veggies, exercise. That's a fine, but please don't use weight loss products when you are breastfeeding. It is not advisable at all, at all, at all. Okay. Okay. So, Rukime, you started your baby. Are you the one that started your complementary feeding? Let me be sure I'm not getting you. Yeah, Rukime, you just started complementary feeding 3 weeks ago, and you're already doing so much food. That's too much. You're already doing sweet potato, yam, rice, fish, chicken, banana, avocado, boiled egg, ewedu, amala. That's a lot for a baby who just started complementary feeding 3 weeks ago. No, that's too much. Like I said, a 6 month old needs to take complementary feeding twice a day. And twice a day, we actually expect you to introduce one new meal per week. So not everything, So I always want parents to go watch the breastfeeding, no, not breastfeeding, the complementary feeding course. I find that parents, we don't get it right when we're studying complementary feeding. So we run into troubles and then we struggle to come out of it. So it's very, very important that we get the complementary feeding right. If you go to our guide section in our uh, Facebook group, we have a lot of global health videos on complementary feeding. So when you are starting complementary feeding, you start with one food at a time and you gradually build upon it. And then you start with semi, like solid, like porridge, like cereal kind, and then you gradually move on to solids. And then the quantity is smaller. Usually you start with something as low as 25 meals of that, like porridge kind of a thing, twice a day. Most of this child's meal should still be breastfeeding. It shouldn't. You are not replacing breastfeeding in complementary feeding. You are adding to the breast milk. So if you give too much, then you are going to stress out your baby. Your baby will stop breastfeeding, and then that's why people say, "Oh, my baby stopped breastfeeding at 7 months." My baby, because you give them too much of complementary feeds, and their tummy is always full of complementary. Then why should they want to stop breast milk anymore? But you're maybe still in the breast milk, because breast milk is still going to do a lot of protection from infection, from allergies that we don't want. So your baby should still be breastfeeding. So at 6 months, your baby should be eating 80% of his meal as breast milk and only 2 extra. And I'm wondering, all this food that you've mentioned is too much for a 6 month old at once. You've done that means we're not following the principles of introducing them. It's okay. There's nothing wrong with all the food. I'm just trying to say that you introduce them one at a time and then you top up on it, and don't do too much. Don't replace all the food with complementary feeding and leave out breast milk. No, you need to do it gradually. So, but all the food you're giving, they are going to be fine. But please try and be gentle and gradually increase. So I would strongly recommend for you to watch the global health videos on feeding. It starts with what to give, how to give, how often to give it. A very, very lovely video, and it's detailed everything. So it will be nice for you to watch. And yeah, so you need to watch that video first. Then it will be easier for you. Okay. All right. Let's move on. Yeah. Yeah, your baby should not just be breastfeeding overnight. Your baby should be breastfeeding during the day. That's exactly the point. Because I can imagine that with all you've listed, I actually was wondering remember the baby's stomach is just like this. It's not so much. So if you put too much inside, it will be too much for them. So you really need to do it. And there's no hurry. You also don't want to overfeed the baby and make baby to gain too much weight and all that. So you need to know what is the right quantity, but I'm happy that you are doing, at least you are using food, normal natural food, which is quite good. But I think you just need to understand a little bit more about the quantity and how you gradually take it up. I hope that will be helpful. Okay, I need to go back to Facebook group, but okay, I think I've answered the question about can my baby sit on my lap. I already stand on my lap. I said no. Don't make your 4 months old stand. There's no hurry. Just relax. They will standing is at 9, 10 months, so there's no reason to be able to rush the babies through it now. Just let them sit for now. All right, let's go back to Facebook. Rosemary is saying quadruplets have repeated rashes, been to the hospital twice. Doctor keeps saying it's reaction to either food. What do I do? The skin itches and scaly. They are 14-month-old. Rosemary, I would say see a dermatologist. So it's not every doctor that can treat rashes. So if you've been to your doctor 3 times and we still don't have a solution to the skin rashes, it's a time to see the specialist when it comes to skin rashes. Because if your doctor says it's due to allergies, the question that should have been asked is what exactly is the child reacting to, so that you can stop the food or whatever contact it is. So I guess you are in the doctor, you are not sure what exactly the child is reacting to. So sometimes you may need to see dermatology, because sometimes dermatologists are not sure, but they can do tests. They can do allergy tests where they actually know what exactly is the child reacting to. Some children can react to food like your egg, your fish. They can react to anything, so they will need to do some tests to know. But it may also not be allergy, it may be a complete skin. It also may be a condition like atopic dermatitis, which is an allergic skin reaction but tends to be recurrent. So, and the way we manage this is different. So it's better you see the dermatologist and they can help you with that. So that's my recommendation. Okay, and another Facebook user is saying I posted last week. Okay, so did we answer your question last week or not? Or we didn't answer. How do you determine a good pediatrician? As with all other professions, not all pediatricians have confidence in treatment they give. Some of them make matters worse. How do we know the experienced ones? Okay, that's a very important question. Number one, let me start by saying that it is not every doctor you see or every doctor who goes to the hospital, when you go to the hospital, who sees your child that is a pediatrician. I think that's just first start by saying that, because many people always tell me, oh, I saw the pediatrician said it, the pediatrician said that. And immediately they say what the pediatrician said, I know it's not a pediatrician that said that, because I know what a pediatrician will never say. So I know exactly that this person who told you this cannot be a pediatrician. So, and somebody was asking me the other day, is there a particular clothes that pediatrician wears or not? There is none. We don't wear any special clothes, and sometimes we don't wear any lab coats or scrubs, because we try to be as natural as possible for the children so that we don't scare them off. You know, some children, when they see white coats, they get what we call white coats hypertension, or they become so scared of the doctors because they think you're going to give them injections and all that. So we sometimes pediatricians tends to wear no special clothes. So you don't recognize a pediatrician by that. So the way to know a pediatrician is to ask. That's just the truth. Ask, are you a pediatrician? Yes or no? You know, especially if you are going to private hospital. So for example, if you go to a government hospital and you go to the pediatric department for children and they say the person is a consultant, usually the consultant will be a pediatrician in the pediatric department. But we also have pediatricians who are in training, so that is also possible. And but you also have doctors who are general doctors who are not pediatrician, but they can also see children. So if you really want to know who a pediatrician is, you just need to ask, or you need to go to the hospital where you're sure they have pediatricians. I always tell people, most Nigerians, especially, it is your right to know who is the doctor treating you. There's a patient's bill rights, patient's bill of rights, which has been launched even in Nigeria. So as a patient, you have some rights, you also have some responsibility. And one of your rights is to know who is the doctor treating me, what is your expertise, what is your experience. So it's not a rude question to ask. It's not a rude question to ask. Are you a pediatrician? It's a yes or it's a no. How long have you been practicing? It's a 5 years, it's a 10 years, it's a 15 years. Is the doctor has a right to tell you. And if you think you're not comfortable with the doctor who is not a pediatrician seeing your child, you also have a right to take your child to where a pediatrician will see your child. If you go to a government hospital, by the way government hospitals are structured, for example, if it's a teaching hospital, it's a teaching hospital. We got to train doctors. So in other words, if nobody trains me, I won't be here as a pediatrician today. So we got to train doctors. So you have to understand that consciously or unconsciously, whether you like it or not. Once you go to a teaching hospital, you will be used for teaching. We try to ask you, Madam, will you cooperate with us? But what that means is that doctors who are in training will see your child because they have to be trained. Or else we wake up one day, there'll be no more pediatricians because there's nobody that's been trained. So we have to train other pediatricians as well. But also the consultant will be there to also see your child. So, and now, how do you know pediatricians who are confident or not confident? Honestly, that you have to. I don't know how you're going to know. Sometimes people make recommendations based on their like if you have been to if your friend has seen a particular pediatrician, they can recommend, okay, this pediatrician is good, but sometimes you just have to find out by yourself. So of course you don't always have to go to the same doctor if you don't have confidence in your doctors. So, but I always say most time if you go to government hospital, because government hospital, the process of having doctors is a little more thorough. People are checked properly before they become like they are putting in position. So you will likely come across doctors who are well trained, because sometimes in private hospitals, some of them you are not really sure who they are. But like you said, most private hospitals also, the doctors, the pediatrician will put their certificates behind their back just for you to know who they are and all that. But really, it's a difficult question to answer. So, but but we have a lot of good pediatricians. Most pediatricians are good, and so when people say you are not sure they're confident, I have a feeling that most likely you are seeing maybe general doctors or medical doctor, general pediatricians, general practitioners. Some of them may not be confident when it comes to children issues. So that's that. But if you're seeing a pediatrician is somebody who has gone into training maybe for over like 15 years before they become a pediatrician. So you cannot do all that years and go through your exams and not be confident when you're seeing children, because that's what you've done. So you've done your normal 6 years of medical school, and then you do your NYSC, and you do your house job. So that's 8 years. Then you go for another 4 or 5 years to become a pediatrician, where you actually go when you're going through that process. You do a lot of exam, a lot of process. So it takes to become a pediatrician take another maybe 12, 13 years. So most pediatricians, by the time you finish at that level, before you even be passed to become a full-fledged pediatrician, you go through that process where you are assessed by other senior pediatricians. So most pediatricians, I can assure you, are confident when they are treating children. It is your responsibility to make sure you're actually seeing a pediatrician when you take your child to the hospital. So that's all I'm going to say about that. So I hope that is helpful. Okay. Facebook user say my baby of 8 months has no teeth. Is that normal? Yes, it is perfectly normal. Some babies don't have any teeth until they're about 1 year old, and there's nothing to worry about. So this person is what causes big navel. So big navel is what we will call hernia. We call it umbilical hernia. It's quite common in Black children. What basically happens is that when there's the baby is joined to the mother through the placenta from the mother, which nourishes the baby in the womb, goes to the baby through that umbilical cord. And so when doctors cut the when you have your baby, we cut that umbilical cord, and so that there's a hole there. There's a hole through which nourishment, everything is passing from the mother to the baby. So it's supposed to close. So it should close properly, and that is where the navel is. Sometimes when it is closing, there's still a little hole left. It doesn't close completely, and what happens is that like intestine or things in the abdomen, they can pass through that hole, and that is what causes that swelling of the navel or big navel, or what we call umbilical hernia or idodo in Yoruba and all that. So that's why when you press it, you will see that it's going down. So it is the hole that some things can pass through. When you press it, it goes down. Sometimes on its own, it will close. As the baby gets older and gets bigger, it's closed. But sometimes it doesn't close quick it doesn't close and it remains big, or it is so big, the hole is so wide that so many things are going through, and sometimes in the process of things going through, they can become obstructed, like, you know, the intestine can get kind of kinked through that space and cause complications. So usually the surgeons will want to operate the baby so that the intestine can be free, and then they will close the hole by operation. So there's operation that can be done. But most of the time, they tend to wait for 5 years to see whether it will close by itself, especially if it is not giving the baby any abdominal pain, it is not causing any sign of obstruction, no complication, no strangulation, all the usual complications. If there's none of those complications, we tend to wait for 5 years to see whether the hole will close by itself. But if it doesn't close, or you are really worried it's too big, or it's giving complication like it's getting obstructed, then you can see the surgeons, the pediatric surgeons, they will open. It's a very not a big procedure. They will just go in and close the hole so that there will be nothing coming out of it. So it's nothing to worry about. Please don't tie the womb, don't put anything on top, just leave it alone. Most of them will close by itself. Don't do any of the usual things people will tell you to do. All those things doesn't do anything. Okay, good evening, ma. How can I know when my baby has tongue tie? Yeah, a doctor or a nurse or any health professional, we need to examine your baby to know whether your baby has tongue tie. But I don't know why people worry so much about tongue tie. I actually wrote an article much ado about tongue tie, because tongue tie does not cause any harm to your baby. It doesn't do anything to baby. It doesn't mean your baby will not cry. It doesn't mean your baby will not talk. It does not cause anything, unless it's really, really very bad, kind of tongue tie, which even the baby will not be able to lift up the tongue at all. So most of you that your baby is lifting up the tongue and crying, your baby doesn't really have any tongue tie. But because most of you like to worry so much about tongue tie, some people will say we're going to have to cut the tongue tie, and they just collect money from you doing nothing. Just snip what we call the frenulum, which is the part that joins the tongue to the floor of the mouth. So just leave the baby alone. That's my own admonition about tongue tie. But if you're worried about it, go see a doctor and let them examine your baby. Okay. At what month can a girl start sitting? At what month will the baby start sitting? My baby is 3 months old, and what are the signs I should start sitting? So if you need to know what's our normal developmental milestone. So for this person, I will recommend that you go to our website and read developmental milestones article, so you know when to expect. So usually, for example, your baby should start sitting with support by 5 to 6 months. Your baby should start sitting without support by 7 to 8 months. Okay, so when your baby is sitting, sometimes you may see no signs, sometimes you just see the teeth. There's really no reason for you to worry about it. Sometimes they can start rubbing their gum or biting on things or drawing a bit of saliva, but usually most of the time you will see the teeth when the teeth appears, and there's really no need for you to worry about it, because you don't need to do anything about these milestones. You don't need to give any medication. Those things will happen by themselves. You don't need to do anything about it. So just relax and let your baby develop on their own. All right, another person is saying, what causes recurrent infection after treating sepsis? October in my 12-month-old baby. Birth weight was 1.8, current weight is 8.8. So your baby was a preterm baby. Your baby being preterm baby, you should be seeing a pediatrician regularly. Okay, so your baby needs to be monitored regularly. So your baby should not be having recurrent infections. So it starts for something as simple as hygiene and washing. These babies don't have as much immunity like children who are born term and obviously who are older. So we really need to make sure we maintain good hygiene around your baby, and you need to really be seeing your pediatrician. And for your preterm babies, please see a pediatrician. Don't just always take everything infection, because the way we analyze their white blood cells and all the full blood count is different from the way we analyze those of term babies. So sometimes their white blood cell may be higher and it's still not a sign of infection. So I really would be very careful taking your preterm baby to general doctors, because they will just go by the level that that people will use for every other person else. But usually for preterm babies, it's not necessarily true. So it's better you see your pediatrician, and your pediatrician should be able to work out for you. Because that is why you need a pediatrician who is following your baby up, preferably the pediatrician that managed your baby when your baby was also born preterm, so they can be monitoring your baby. They know what could be going wrong. They know what could be that they can explain it to you, and it's very, very important. But there are many reasons why a child could be having recurrent infections. It could be something external to the baby, like if the baby is being exposed to germs, good hygiene is not being done and all that. Or it could be the baby has some immune problems as well, so that's also need to be looked into. So many issues, but that's the job of the pediatricians following up the baby. So, good evening. How can one detect pneumonia in babies? I noticed that when my baby while crying, the leaves become a little darker in color. Okay, so pneumonia doesn't necessarily make your baby's lips become darker in color. That's a different condition entirely. So for pneumonia, babies have fever, they have cough, they have fast breathing, they have difficulty with breathing. So please take your baby to the hospital if you're having fever, having cough, having fast or difficulty with breathing. They are breathing with so much effort. Breathing is something that should be noiseless and effortless. So if a child is having fever, having cough, is having so much effort to when they're breathing, you should go and see a doctor, because they may have pneumonia. But if your baby is changing color, usually it's very difficult in those of us who are dark skinned, but in people that are white skinned, we tend to have what we call bluish discoloration of their lips and or tongue, and we call that cyanosis. It means that the oxygen level in them is getting low. So in dark skin people, you may not necessarily see, but you may see, like you said, darker color of the skin. You need to take that baby to the hospital. I don't even care what is causing it. You need to, because what we need to do is we need to use what we call a pulse oximeter. So we will check the oxygen level in the child, and when we check the oxygen level, then we can now know whether it's low or normal. If it is less than 95%, we worry, and then we need to know. And the commonest thing we worry about is a heart problem, because if your child is having pneumonia, dark color of lips or cyanosis is even the last thing that will happen. The child would have given other signs like fever, like the cough, like the breathing difficulties, before the lips will start turning blue. So that one is a late sign, even a child with pneumonia. But a child who is otherwise well, but having their lips turning blue or anything, or turning dark, we need to make sure the child doesn't have a heart problem. That is the most important thing, and it's important that that baby should see a pediatrician quickly. All right. Somebody say, what can I give to my 7-month-old to add weight? The postpartum need for us to know first, what is the current weight of your baby? Does your baby really need to add weight to start with? So I think it's best you tell us the weight at 7 months and the birth weight, so we know what it is. But more importantly, all you need to do for a 7-month-old is to breastfeed your baby and give complementary feeds. So you go to our Facebook group, go to the guide section, go to guide 2. The guide 2 is on complementary feeding. There's an article, and there are like about 5 or 6 videos that tells you what to give, how to give it, how often to give it, what not to give as well. So those are the things you need to go through. I always recommend that everybody who have infants, before you start, even the baby eats 6 months, you need to go through that. I find that when people have that understanding and then they follow it, it's easier. So if you are giving your baby good food, the right nutrition, your baby will gain weight. We are not interested in your baby just gaining weight and become very big or chubby. We want baby to have a healthy weight, because sometimes some mothers want the baby to just be unnecessarily fat, because I don't know, maybe they get some satisfaction in the fact that your baby is very big and heavy for everybody to carry. Being overweight is also a problem. It's actually malnutrition as well. We want your baby to have a healthy weight. So That's the most important thing. I always want mothers to bear that in mind, because sometimes when you tell me the weight and you're still worried about weight gain, whereas baby is actually having a normal, perfect, healthy weight, then I know there's a problem, because we do a lot of comparison. It's not a comparison. It's not a competition. What is important is your baby is healthy, not necessarily that your baby is the biggest or the fattest. That can actually be a problem on its own as well. I hope that is helpful. All right. For those who are asking that question on our Facebook group, you will post your question on our Facebook group. Somebody can give you the link to all those information on how to get to the guide section. I hope that is helpful. All right. Yeah. Okay, let me quickly go back to Instagram. Okay, we have 10 minutes to the end of the program. So please, I will beg your indulgence not to post more questions, so that I will use the remaining 10 minutes to clear all the questions that I have. But you can always post your question on our Facebook group, and um on our Facebook group. Okay, so Rookie May, again, I worry about your baby, because you are giving so many things and you are giving them all together at the same time. The problem with your method is, if your baby reacts to anything, we will never know what your baby is reacting to. So, like I told you at the beginning, please give only one food item at a time. And then when your baby has taken that particular food item, you're sure your baby is not reacting to, that's when you hide things. You are doing too much. Honestly, that's the truth. You need to stop and go back, do that complementary feeding, and go again gradually. Your baby is 3 months, and your baby is just 3 weeks on complementary feeding, and you are already feeding like somebody who is a year old. That's too much. Okay, Amaka is saying, what does GERD mean? So GERD means gastroesophageal reflux disorder. For those who are wondering, is, I guess maybe you've gone to your doctor and your doctor told you your baby has reflux. My baby. So you tell me the age of your baby, because I really want to be sure. Number one, how old is your baby? What then? What are you feeding your baby with? Then we'll talk, because I don't want to start saying something and then say, oh no, that's not it at all. Okay. Everlush perfume. Can I add fruits, watermelon as complementary food assessments? You can give fruits assessment, but if you're going to give watermelon, obviously you have to remove all the seeds, obviously, and you have to puree it. But again, please go to our Facebook group, go to the guys section, and do the calls, the videos on complementary feeding. Most hospitals will want you to see a medical officer first before recommending to a pediatrician. Most time they don't. Exactly. And the reason is because you don't need to see a pediatrician for everything. Most times a medical officer can see your baby for small issues. Your baby has malaria, your baby has cough and catarrh, your baby has, common issues. Our family doctors, our medical officers, they can take care of it. You don't need to see a pediatrician for that. In some countries, like in the US, for example, every child has their pediatrician, so that is their own method. In Nigeria, it's not that method. In Nigeria, the general doctor see your baby first before you see a pediatrician, unless your baby is a baby who has special issues. For example, if your baby is a preterm baby, a pediatrician should see your baby right from the beginning. No general doctor should be seeing a preterm baby, premature baby, and all that. So, but if your baby is otherwise healthy, normal baby, no issues, no health issue, no special condition, a general doctor can see you for malaria, can see you for cough and catarrh, and they know when to refer you to see a pediatrician. So that's no problem at all. She fell girl dog. My daughter of 2 years, 9 months pee in her pants in school these days, and she doesn't do it at home. Should I be worried? Yes, I'll be worried if your baby is peeing at school. So you need to go to school. You need to go and ask, what is the problem? Is it that the child, because a 2 year, 9 month old baby, really, they need to take the child. If the child is not yet fully potty trained, then they need to take the child to wee, and they need to do it during break time. Sometimes the children are so scared of the teachers, they don't want to talk, they don't want to raise their hand. There's something, they may just be scared of something. So you really need to go. Really, as far as pediatricians are concerned, your 2 year, 9 month old should be at home with you, not in the school. Really, they shouldn't be at home. And if they go to school, like a play group. They should be there for maximum 2-3 hours a day and should be back home. I know in Nigeria, most of us use the school more or less like our daycare, because you just need a child to be out of the home so that you can also go to work. But really, school for pediatricians starts at 5 years, 6 years. All those other things before that is preschool, is play group, and children should not be long in the school for so long. So they should be, and the teacher should have that mindset. So you really need to be the one to go there, really understand what is happening, and make sure that they're not putting these children under unnecessary pressure. There's no pressure for a 2-year-old. A 2-year-old should just go and play. That's all they need to do. That's not the time for them to be learning and be putting under pressure to learn, to write, to do. No, they should just play. They should just play with other children. That's all we want them to do, and learn to talk. So I worry that there's something going on in the school, and you should go to the bottom of it with the school. All right. Pressures are there. My baby is 11 months old and I just found out that I'm pregnant. Wow, congratulations. You don't just find out that you're pregnant. You didn't do family planning, so you'll be pregnant. So I don't know why mothers always do that. Anyway, what's the question? Should I win him? No, you don't have to win him. You can keep breastfeeding. As long as you're okay, you can breastfeed, and you can do you can keep breastfeeding for as long as you want to. And then when you have your other baby, you can stop. So it's up to you really, if you are able to cope, breastfeed. But if you think you are struggling, your nausea and vomiting is bad, you can't cope, then you have no choice than to win your baby and give, but you have to give age appropriate formula. Okay, so I always tell mothers, because people do ask this question all the time. Yours is not even bad, at least 11 months, not too bad. But people ask the question all the time. Like some will say, I'm even, I think the youngest I've gotten is somebody who is 2 months old baby and she's pregnant already. I mean, if you don't plan to, if you're having sexual intercourse without any form of family planning, you are going to get pregnant. There is no surprise there. I always wonder why you guys are always surprised. If you don't want to get pregnant, then you have to do contraceptives. You have to do contraceptives. But if you just family breastfeeding is not enough. So as long as you are having sexual intercourse and you are not using any form of contraceptive, you can get pregnant anytime. So don't be surprised when it happens. I don't know why mothers are so scared of family planning. There's no reason to be scared. There are so many options. There's tablet, there's implant, there's injections, there is IUCD. You just go to the family planning. Family planning is so important to us as pediatricians. So we really want you to do family planning, because we want you to space your babies, because you need to recover. You need to recover before you go through another pregnancy. Most of you think it's nothing, it is. It is not. You are stressing yourself. You are going to stress the new baby. You are going to stress the other baby. It's a lot of stress. We really want you to space your pregnancy 2 years minimum, so that you recover fully. Like now, you are still breastfeeding. It's a lot of stress on you. You are breastfeeding. You are pregnant. There's so much demand on you as a person, and it wears you out. And we really need you. We really need the mothers, because we want you to be alive to take care of our children, because if you are not there, nobody else can do it like you. So if not for the children's sake, but at least for your own sake, please don't just leave it to chance. Go for family planning. Forget all the myths that if you do family planning you won't get pregnant on time. It's not true. Or there are many options. Or you can even do condom. You can ask your husband to use condom. I know most of you don't like to do that. So the best option is to go for, even if it's just injections or IUCD, there are many methods. Please do it so that you have enough time. You shouldn't be getting pregnant when you're still breastfeeding. You should have finished breastfeeding, relax, then you're ready, you plan to have another baby. Then you start planning, you should now get ready. No, it shouldn't be happening when you're not planning to. So that is our own that's a professional advice I'm giving you. I know that some people may not like it, but that's actually the professional standpoint. Okay, but don't worry, you'll be fine. Hopefully. But please register for antenatal as well. Grace Ayobami, my baby is 5 months. Can I give him fruits and egg yolk? No, you can't. You can only give your baby complementary feeding from 6 months. So wait 1 more month. After 1 month, your baby is 6 months old, you can start complementary feeding. Then what I recommend for you now is to go watch all the global health media videos on complementary feeding, so you know what to do and how to go about complementary feeding when it is time. There is no advantage in rushing to start complementary feeding. No. So when pediatricians make recommendations, there are lots of science behind it. People have done research. We don't bore you with all those jargons, but there is a research behind each evidence. So if you say you should only start it at 6 months, there is a reason why. There's a research behind it. So don't rush. Exclusive breastfeeding for the first 6 months is what we recommend. Then from 6 months after, then you can start complementary feeding. So please don't start too early. All right, I hope that is helpful. Okay. Where am I now? Okay, yeah. Okay, I think I've done this one. All right, so I'm coming back finally to, okay, time is up. So please don't drop any more questions now. Time is up, but I will try and answer the question that have come in before 7 p.m. Okay. Yeah, okay, I think I've answered the question on pneumonia. Sorry, I have to go back. Okay, yeah. Okay, this is where I am. 9 months old is weighing 6.5. Stopped breastfeeding 3 weeks ago. Why? It was 6.5 in July and it's 6.5. There's something wrong, Temiloluwa, and stopping breastfeeding is not the solution. You should not stop breastfeeding your 9-month-old who is not gaining weight and who is having static weight. You should keep breastfeeding and you need to give complementary. But you didn't tell me what kind of food you're giving. You only say after meal. There's nothing magical about after meal at all. But you need to see a pediatrician because we need to work out why is your 9 months old not gaining weight. So we need to know why. It may not necessarily be food. It could be food, could be there, but it may be other things. It could be health issues. There are many reasons. So I would rather recommend you see a pediatrician and then we can work out what is the reason why your baby is not gaining weight and how we can make your baby to gain weight. But please resume that breastfeeding. You should not stop breastfeeding at 9 months. Okay, I thought I've answered Ogona's question about pneumonia and blue lips. Somebody is asking when we get the information on complementary feeding on our Facebook page. You have to go to our Facebook group, not our page. So if you go to our videos, if you go to the videos section on our page, you will see it as well, but it's not grouped together. But the best place to get it is on our Facebook group. But if you go through all our videos on the Facebook page where you are now, you will see some of the videos on complementary feeding. But if you come to our Facebook group, we've put it together as a nice course for you that you can read everything in one go. Is it normal for a baby to grow up at it first? Yes, it is perfectly normal. They are not witches, they are not demons, they are nothing. It is completely normal phenomenon. So please don't treat the baby in any special way, and they don't have any special power. Okay. All right. Thank you, ATP mom. Thank you. Queen, my baby is 7 months, 22 days, born at 35 weeks. Notice that his breathing is sound like he has catarrh. Complaint to pediatrician. See another pediatrician. Baby was born at 2.8, but he's 8.5. Is there anything to worry about? You didn't tell me what the pediatrician said, and your question is cut off. I can't say the rest of it. But if you have seen 2 pediatricians and they are not worried, I'm most likely I'm not going to be worried about your baby. So, but I believe that my colleague should have explained to you what they think. I guess your baby may have what we call noisy breathing. There are many reasons why that could happen. You know, it could be something as small as the fact that the airway of the baby is, is flexible. So when the air is moving through, it makes a lot of noise. It could be your child has laryngomalacia, which sometimes we don't do anything about it because we know it's also, after a while, it's become more matured and there's no, or it could be adenoid. There's so many things, but I don't want to assume what it is because I've not seen your child, but you've seen 2 pediatricians. So I think you should just ask them what exactly they think is wrong because I think they are not worried about it. And so I don't think you should be worried about it as well. But you may want to see them and ask them to explain it to you. My 6-month-old is on a big size, her body is cutting. like a leg, a neck, a whole folds, and anytime I check, what is the weight of your baby? And in Kiro, that's more relevant for us. So, but I guess you are saying your baby is very fat. And when you say cutting, do you mean like folding, or you can see wounds, or is it like rashes in between the folds? Because there are several things that could be going on here. So I really, really want to understand your question. I'm sure of which the time is gone. But if your baby is having, because babies who have fats and who have a lot of skin folds, they tend to have fungal infection, what we call intertrigo, in between those folds. So you really need to make sure that when you're washing your baby, you take extra effort to wash in between the folds of their skin. You wash in between the folds of their skin, and if there's any rash there, you see a pediatrician. Because, for example, if you have a fungal rash, we need to treat it properly with appropriate antifungal cream and all that. So you need to do all that. But I would rather you see a pediatrician first so that you know what is going on. My baby is having discharge from his eyes. He's 2 years, 5 months old. What kind of a discharge? Is it whitish, yellowish? Is it present from morning to evening? Any redness of the eyes? Any itching of the eyes? So when you give us information, we need to ask you a lot of questions. So this question will help us to know whether it's a discharge we should worry about or is nothing normal. So I would just say if a child has a discharge, just clean it first with a clean cloth and water, and then see. But if you clean it in the morning, maybe when baby is having the bath, but it keeps on coming out throughout the day, or it's yellowish, or there's redness of the eyes, there's itching of the eyes, your child may have a kind of a conjunctivitis or infection, and you need to see a doctor, not necessarily a pediatrician. Any doctor can treat. They may give you appropriate eye drop. But because you didn't give me additional information, I'm not sure whether this is something I should worry about or not. Okay. I would like to know how many hours interval to feed a newborn baby. My baby suck like every 10, 20 minutes. When she start crying, you breastfeed, I should keep quiet. Okay, so we say breastfeed newborn babies on demand. So on demand means when your baby cry or when your baby shows signs that they want to eat, you feed them. But that should be averagely between every 3 to 4 hours. Averagely every 3 hours, your baby should be eating. So they should be feeding about 8 to 12 times a day. So it's not every crying that is hunger. I think I really wish I don't know how to say that. I really need to say that to all the moms, because I actually Nigerian moms, because moms always think that whenever their baby cries, it's because they want to eat. No, there's so many reasons why babies cry. So sometimes they just cry because they want you. They just want their mother. They just want to feel their mother. Sometimes they cry because they are just bored. Sometimes they cry because they are happy. Sometimes they cry because their nappy is wet. Sometimes they cry because they are hot. Sometimes they cry because they just want any attention. So it is now the job of a mother to know which is a cry for food, what is a cry for wet nappies, what is a cry for I'm bored, what is the cry for I want my mom near me, I want to feel I want. It's a lot of work. Unfortunately, they don't come with a manual, so it's difficult for you to know. But after a while, as a mom, you begin to figure it out by yourself. Because, for example, if you just feed your baby, their tummy is so full, and your baby cries, that next cry is not for hunger. Trust me, they are crying for something else. So you had the mother as the one that. So don't always assume that. And this is one reason why many mothers don't want to do exclusive breastfeeding, because they think, oh, my baby is always crying, my baby is always crying, and they think that that means that they are not feeding your baby enough, even though the baby is vomiting all the breast milk out because maybe the milk is too much. They still think they're not feeding enough. So I'm here to tell you this evening and to reassure you, all your mothers, that your baby crying does not necessarily mean they are hungry. There are 1,001 reasons why a baby can cry. Sometimes you don't even know. They cry from colic, for example, which is what we define as crying for no reason, for we don't know why. So sometimes this happens. So don't always assume every cry is food. If your baby is sucking 10 to 20 minutes, your breast is empty, their tummy is full, they've had food. It is the crying is not hunger. So don't always use breastfeeding as a comfort, as a what's it called now, like a dummy for them. No, if you give it them, they will take it, because breastfeeding is comforting, breast sucking is pleasurable. So babies will suck for all the reasons apart from food. That's another thing I need to say. That's actually a very good corollary to the first thing, to say that not all crying is hunger. Two, not all sucking is because they want to have food as well. So it is when mothers get that, then you'll be delivered from letting your baby using their cries to manipulate you. So with time, what I always tell mother is figure it out by yourself. If your baby is crying, check, is the nappy wet, has the baby poo, maybe they need to have a change of nappy, is the weather hot, is it too cold, feel that. Have the baby eaten in the last 2-3 hours? Most likely they are not, that's not hunger. So you just triage it out. That's how you do it. And then sometimes they just want comfort, and you just carry them, comfort them, and put them. Sometimes they want to sleep as well, but they are struggling with the sleep, and they will cry as well. So if you're feeding your baby every 3-4 hours and you sure really as you are lactating well, the milk is flowing, the baby is sucking it well, you can feel your breast empty. It is not because you're not giving enough food. Your baby is crying for other reason, and you don't have to breastfeed for every cry, because every cry is not hunger or food. So the wisdom for you to know the difference is what makes you a mother. But with time, you begin to figure it out yourself. Okay, your baby is 9 months old, weighing 7.7. How good is that? Not bad. Usually we want baby to weigh 9 kilos, but 7.7 is close enough. But make sure you're feeding baby well. Please do complementary feeding course, and also make sure you are breastfeeding as well. When should my baby be able to stand on my lap? I don't want your baby standing on your lap. I don't know what is the problem with all these babies standing on the lap. We don't want baby standing at 3 months, at 4 months. We don't want them standing at that age. There's no reason to be putting pressure on the baby to stand. Your baby should sit. Your baby should lie. That's what we want them to do at 3 and 4 months. Okay. When they're about 8 months, when they're able to sit perfectly without any support, get on the crawling, then they can begin to stand. So there's no pressure to get them to be standing on your lap. That play with play and making children to stand is actually not necessary. And you don't really need to do it. So you just leave the baby. Because most of you are asking this question because you are trying to make them do it, and the baby doesn't want to do it. And then you begin to worry, oh, my baby is not strong, my baby is weak. No, baby should not be standing at 3 months. They should not be standing at 4 months. Why? Why do you want them to stand? There's no rush. You just relax. Before you know it, they'll be 18 years and out of your hair. So just relax. Okay, my baby is 2 weeks old. She has rashes on her neck. Okay, so I can't see a rash. I can't tell you what to do without seeing the rashes. So our advice, you post the question on our Facebook group with a picture of the rash, and then we can tell you what to do. What age do we introduce sugar in baby pap? So baby should start taking complementary feeding at 6 months old, and pap can be started. But please, your baby should not take only pap alone. It has to have other things. So you can add milk, crayfish, egg. You have to fortify it, a little bit of palm oil, and mix it, boil it together. So it's what we call fortified pap. It is not just plain pap. And you can sweeten it. You can sweeten it with the formula that you are using as a milk. You can use natural product like dates. You can use sugar as well, small quantity. So that's that. So you can start when you start complementary feeding. That's okay. Okay, Queen is now finishing our question. Is there anything to worry about? Okay, I've answered your question because, like I said, you've seen 2 pediatricians. Ask them what is actually their concern, and I already they will tell you what is going on. I believe that they are not worried, so which means that you should not be worried, but it's better they explain to you what exactly is going on. Perpetua, I think I just answered your question about sugar. When your baby is on complementary feeding, you can sweeten the pap with sugar, but you don't have to make it pap all day. And obviously, you don't need to use sugar all the time. There are other ways you can sweeten them as well. But if you want to use it, you can use it as well. Okay, all this question about pap, sugar, coca host, please do the complementary feeding course so that you have all this information and all that. Oats has calories, it's a carbohydrate source and all that. But that's not the only thing your baby should be taking every morning. Try and give variety of food to your children. Okay, I think Temiloluwa, we've answered your question already. I don't know why you repeated your question. I've answered it already. How many times should I breastfeed your baby after I start complementary feeding? That's a very good question. So what we normally answer is that you keep breastfeeding your baby the same way you are breastfeeding them before you start complementary feeding. You don't stop breastfeeding them, or you don't reduce your breastfeeding. So breastfeeding, like we said before, is on demand. So you are not putting it to time. So, but you just breastfeed them as often as baby wants it. The only thing is that we know that at 6 months, breast milk, no matter how much of breast milk your baby take, because they have limited capacity of their stomach. So the volume that the stomach can hold, because it's more of liquid stuff, it's not going to be enough calories for the baby. So they need to have solids. And that is where introducing solid come in. So because solid is smaller quantity, but more calories per, per volume. And that is where, so you don't reduce your breastfeeding, keep breastfeeding your baby as when you were breastfeeding before you start complementary feeding. You're only adding, that is why they call it complements. You're only adding to the breast milk. 19 months old have rashes, blah blah blah. It will clear, it will stop. I changed soap, cream many times. Okay, so please stop all that you're doing. You're doing something wrong. You don't need to keep changing your baby soap all the time. You don't need to keep. You need to know what is the cause of the rash, and then get it treated, and then just remain using one particular soap all the time. Preferably use something hypoallergenic. I would recommend you read our group discussion on baby care of the baby's skin, and it's also available on our website. Read that first, understand what is how to care for your baby's skin, the kind of soap we expect you to use, the kind of cream and all that. Then see a proper doctor to treat the skin rash. Don't do self-medication. That's what you mothers do all the time. That you don't, if you make the wrong diagnosis, you're going to get if you put the wrong treatment, it's not going to, you're going to create problems. So stop using this triple action cream. Go to a doctor, let them make the diagnosis of the rash, let them tell you what to do, and do it. And don't just keep using things by yourself. Other people, oh, I'll just go and use that cream. They don't know the diagnosis of the rash. Some rash don't even need any medication. It's as simple as you stopping. Maybe it's a particular soap or it's a particular cream you're using that your baby is reacting to. It's as simple as stopping that, and that's all your baby needs, not even any cream. So it's very, very important that you don't do try and error, guessing. No, you need to know what you're doing and get it right. Because I don't know why you should have used in a 90-month or you have used like 5 different soap or whatever it's, and you're still having no solution. That means there's something fundamentally wrong. So you should just stop everything. That's my own advice. Stop everything. See a doctor to treat the rash first, and let them tell you whether it's a rash that don't even need treatment, and then use only hypoallergenic products. Sebamed products is hypoallergenic, they are fine. You use that and be consistent, but you also need to check, is there other things you're doing that your baby is reacting to? For example, if your baby is reacting to something from the food, until you address that, it will not go away. So you really need to know what is really going on. So because we're not seeing your child now, we can't tell you what it is, but I'll rather you just see a pediatrician once and for all and get it sorted, so you don't keep on changing so many things. Okay, I just stopped giving my baby 1 year, 5 months breast milk. Is there any particular milk? You can use any milk you like. From 1 year, your children can take the same milk like the rest of the family. That's fine. Okay, a Facebook user, please. My 3 months old baby has been having cancer, no cough, no running nose, but the mucus is in nose tree, appears dry. Took him to pediatrician, antibiotics, piritin, dry mucus still appears. Although reduce, what do I do? Nothing. I don't think you should even do anything. I think you don't even give your baby any drugs. I don't give drugs for cough. I don't give drugs for catarrh with no fever, because most of them they don't require any antibiotics. I'm sure your pediatrician gives you that because you've come to them, so they must give you something. But if you have come to me, you have gone with nothing. So without supporting it with my hand can cause baby sleep to drop. That is not true. That's a myth. Last week, all these questions about baby standing on my lap. I don't know what happened today. Everybody seems to be worried about baby standing on the lap. Okay, I've answered that enough. When can I give my baby tea, Milo and milk? No Milo, no beverages. The only beverage your baby should take below the age of 1 year is water and milk. No other beverage. The only thing children below the age of 0 and 1 year should take is water and milk. That's all. Nothing else. Don't give them all those tea, beverage, all those things. They don't need them at all. Why do my 14-week-old baby hum while playing with cranking sound? I'm not sure I understand that question, but there's nothing wrong with your baby making sounds. We want baby to make sounds. Maybe that's what you meant to ask. There's nothing wrong with that. My baby has adenoid. How can I help him to sleep to breathe well when he sleeps? there's nothing you can do. If the adenoid is bad, the surgeons have to take it out. If it's not bad, then just leave him alone. But if he's really struggling to breathe when sleeping, the surgeons have to take it out, because that's one of the reasons for surgery. There's nothing else you can do as a mom. Sorry. Uh, Queen, I think I've answered your question. I can't tell you what not to worry about. You're complaining about your baby's breathing. I can't hear your baby's breathing. I've not seen your baby, but you have seen two pediatricians. If you have seen two pediatricians, then if they've told you not to worry, then don't worry. I don't know why some moms you worry a lot, because even when you see a doctor, they've told you not to worry, you will still worry. So you still want more pediatricians to be telling you not to worry. I actually don't do that. So if you have seen two of my colleagues and they've told you there's nothing to worry about, then stop worrying. If you are still worried, then go back to them and let them know you're still worried, and let them advise you on what else to do. Me, I am not seeing your baby right now. I'm not listening to your baby, so I'm not going to be able to say anything. But I'm happy you've seen two of my colleagues, and that's, for me, is more than enough. So if you are not happy what they tell you, then you can go back or see another person, but you really definitely need to see somebody to know whether to worry or not, because it's better to see your baby than to make assumptions. My baby said it's hot, but body is normal. When I check temperature, it's normal. Then your baby is normal. There's nothing to worry about. Can I give my baby 5 month old baby multivitamin? He has diarrhea last week and I lost so much weight. No. Your 5 month old should be on exclusive breastfeeding, and your baby should not be having even diarrhea to start with. Why do your baby have diarrhea? So was it be on formula feeding? Was it be on bottle feeding? So focus on why the baby had the diarrhea, and I don't know how it was treated. Did you see a doctor? What did they tell you? So those are the things. But vitamin is not the solution. So what you need to do is to give baby breast milk and on demand. 3 months old baby does not have catarrh, but he breathes as if he has one. That's the difficult one to answer. But if baby doesn't have catarrh, then baby doesn't have catarrh. So I'll just say, just don't worry about the baby, just let the baby be. But if you worry, you can see a doctor. Please, what should one do if an EBF baby doesn't poo for 2 weeks? Nothing. Babies on EBF may not poo every day, and they may not poo for up to 2 weeks. As long as baby is fine, baby is not vomiting, baby is not having swollen abdomen or anything, just let the baby be. Very soon they will poo, and when they poo, it will be plenty, and then it may go on for days again without poo. That's nothing to worry about. All right. Luchi is saying, can I stop my baby from sucking his finger? He likes, so it's an habit. Some children just do it as an habit. What I normally do is to use distraction method, give them something that they can play with their hands, so they play with that rather than putting their fingers in their mouth. But most of them will stop eventually. You don't need to worry. Listed Abiodun, my baby complained of pain at the tip of his penis. After a while, it stops. What could be causing it? Maybe nothing. Some children, if there's no discharge, there's nothing wrong with the penis. I would just say just watch. Some children mistaking the usual erection they feel. Sometimes they describe it as pain, based on their own understanding. But if there's nothing wrong, no redness, no discharge, nothing, I will not worry about it. My baby is 1 year and 4 months and she eats tea and custard. So what's the question? What's the first complementary food? She's 5 months. Your baby, 5 months, does not need complementary food. Your baby should be on breast milk. Go to our complementary feeding course. Do it in preparation. When your baby is 6 months, that is when you will now start complementary feeding, and all the information you need is there. Doctor, my baby is 11. Yeah, I noticed a brownish red color urine in her panties for 4 days. Been administering paracetamol every day because she has a sore on her head. 5 days ago, I administered ORS because she was feeling weak. Please, what could be the problem? How do I remediate? I think you should stop. Why are you giving paracetamol every day? For how many days? I mean, for a sore, what is a sore in the baby's head? I think that's what you should be treating. And when you say you notice the reddish brownish, is it your baby is 11 months old? So your 11 months old is not wearing pants. Your 11 months old most likely is wearing diaper. So is it in a urine that has changed color for so long? So usually we don't rely on urine that has collected for long. So because urine will change color anyway. So if you're worried about the color of urine, you need to take the urine fresh. You need get a small bottle, when baby is peeing, take a little bit of it and look at that. If that is really red or brownish in color, you need to go see a pediatrician immediately, because red color urine could be blood in the urine. Brownish urine could be that your baby is breaking down red blood cells. These are what we call co-colored urine or whatever. They are very worrisome signs. They tell us there's something wrong somewhere. So you need to see a pediatrician. But if it is the one that has stayed in the urine, it could have changed color over days. So we don't usually rely on that. You need to collect the fresh urine sample and look at the color to be sure. But please stop giving paracetamol every day. If your baby is sick, please take baby to the hospital. Your baby is having sore, is having diarrhea. I don't know what is going on. It's maybe better. And if that baby is having colored urine, whether red or brown, that baby is sick, I will worry about that baby, and I want you to see a pediatrician and not just see a doctor immediately. And Njume Priska, thank you for joining us from YouTube. I always like to see people from YouTube. Maybe it's 25 months and 13, weighing 30.5. Is it okay? It is okay. What vaccine is required for this age? It depends on where you are. If you're in Nigeria, for example, you don't need any vaccine at 2 years. In some countries, they give them maybe the meningitis conjugate vaccine, varicella vaccine for chickenpox, and some other things. So it depends on what your immunization schedule says. So you should have an immunization card, and in your immunization card, based on where you are, they would have written the immunization and the age to take it. So it depends. So for us in Nigeria, where I am, most of my audience are based, we usually don't give any immunization at 2 years. So, but I definitely know in some countries they do give. Ellen is saying, my 5 weeks old throw up almost all its suck after breastfeeding. Almost all. That is really very worrisome. So babies can have reflux, but reflux is usually very little milk coming back either from the mouth. But if a baby is throwing out all, I always want moms to be very careful when you are reporting. Don't exaggerate, because it can mean different things entirely. So if your baby is bringing out a little bit of breast milk, that is reflux, that is common. You don't need to do anything. But if your baby is really throwing out all the breast milk you fed the baby with, you need to go to the hospital, because that is vomiting, and we need to be sure there's no obstruction anywhere, because that's the only thing that will make a baby throw out all the milk. If there's an obstruction in the stomach, so they will need to go to the hospital. That is something that we even need to do an operation for. So it's that bad. So I always want you to be sure. So think about it first. So if that is like mommy speaks, like some people say, then just check. But if your baby brings out a little bit of milk, that's fine. But if your baby is throwing out all the milk, you definitely need to see a pediatrician, because I worry so much about that. And that baby will not be gaining weight. Baby will be ill, you'll be other signs. So you need to see a pediatrician fast. But if your baby is otherwise well, not forcefully vomiting, bringing out a little bit of milk here and there, that's fine. That's reflux. Keep your baby upright. Don't put them straight down after feeding. And after 30 minutes, you cannot put them down. They will still bring us a little bit, but it won't be much, and you don't need to worry about that. And baby will be gaining weight well. So there's no reason to worry about that. Okay, I want to talk about rashes, because anytime I ask about the doctors on heart, I need to go to the hospital so that I can diagnose the kind of rash and cause. Yes, your doctor is right. So a layman, is there a way to identify a rash? No, there's no way. Sorry, you have to go to a medical school for that. There's no way a layman you're going to diagnose a rash caused by bacteria, fungi, and you're not going to be able to do that. Sorry about that. Even us as pediatricians, we get to a point we don't know what the rash is. We have to go to the dermatologist. So there's even no way a lame person is going to do that. So why are you worried about going to the hospital? There's nothing wrong with you going to the hospital. Go to the hospital, see the doctors, and let's do our job. Unfortunately, that's how things are. Chibuso, I say my baby is 10 weeks. We are scheduled for 10 weeks immunization. Because of when she was given rotavirus, I'm confused. When I'm not sure I understand this question, but there's nothing wrong with your rotavirus or your baby going for just go for your 10 weeks immunization. It doesn't matter when the baby was given rotavirus or not. 10 weeks, baby should go for 10 weeks immunization. So there's no problem about that. Okay, I don't know. Okay, thank you, everybody. All right, I think I'm almost done. Okay, I thought I finished. How often should I feed my 7-month-old please go and do the complementary feeding course. It tells you how often, because there's more to it than just how often. I really want you to do the course first so that you understand that. Can you use regular brown crayfish? Is there any other kind of crayfish? I think there's only one crayfish, or the red. Okay, the red one. You mean the big? That's the prawn, because I think there's only one crayfish. Okay, I get the big red one is the prawn. Yeah, yes, use the normal crayfish. It's fine. Okay, usually that's the easier one because it has to be blended and into powder. Okay. Thank you for your constant teaching. Maybe you have recurrent rashes. This is so many antibiotics. Please, if your baby is having recurrent rashes, please see a dermatologist. If you struggle to see one, we have one in our ATP clinics. We can link you up with one, so we can. Of course, it's consultation, so you pay for that. It's not free. Can my baby of 3 months start taking water? No, no, no. Your 3 months old should be on breast milk only. Breast milk only, no water. Water is from 6 months when they start complementary feeding, because breast milk itself already has 80% water. So there's really no reason to give any water again. Okay, my baby's poo is green. Have gone to the hospital. Hopefully they've told you something, because you didn't tell me the age of your baby. You didn't tell us what you're feeding your baby with. But I believe that my colleagues in the hospital would have sorted it out. No, 3 months old, no water, please. 4 months old, no water, please. Okay, everybody seems to be, it's the water, it's this time for water question. 4 months old, no water. Why are you asking the same question so many times? Please don't give your 4 months old, your 3 months old water. Give them breast milk only. I think that is as clear as it can be. I don't know why we struggle to understand the word exclusive breastfeeding. Exclusive breastfeeding means breast milk only, no water. Kufaya say, my 6 months old have toes and finger pains. Can low potassium cause this pain and make her lose consciousness after vomiting? Really? Wow. Are you a doctor or a nurse? Because the word potassium is not something mothers use a lot. Anyway, but I worry about your baby, because your baby is vomiting, is your baby losing consciousness? You need to really see a doctor now. I'm not sure potassium is what is causing the pain anyway, but I worry about the child losing consciousness after vomiting. But dehydration, a baby vomiting can get dehydration, can go into shock, and that can cause, but I don't even think that has anything to do with the pain. So, but see a doctor. Your baby is very sick. You need to see a doctor. My 11 weeks pulling is here as if something is eating up. There's no light on there. What could be? Just an habit. Children pull their hair out of habits. You don't have to worry about that. 4 weeks is weighing 2 kilo. He was 1.8 at birth. Your baby should be seeing a pediatrician. Your baby is was your baby preterm baby, because 1.8 is low birth weight, and your baby is still not gaining weight well. But then I don't know whether baby was sick, whether baby lost weight and now is beginning to gain weight. But I really want your baby to be seeing a pediatrician, Rachel. I worry about that. All right, thank you, Falade. Day, my 7 months old won't eat at all, suck breast and cheese ball. No, please don't be giving cheese ball to your 7 month old. Let's not start with that. Let's not start with all these junks at 7 months. Please give them real food at 7 months, not cheese balls, not junks, and no biscuits, not all of those junks, please. Yeah, you really need to understand how to go about complementary feeding. Don't need to give her any drugs. I really, really want you to go and do our complementary feeding, because that's why I keep saying it seems like I'm singing that song now. But you really, if you watch those videos and do, because you begin to understand what I'm trying to talk about, because it tells you what to give your baby. It will tell you what not to give, like all these cheese balls and all those tea and all those things people give. It's not necessary to give your 7-month-old. And you need to understand how to go about introducing food properly, because if you don't do it right, then you're going to complain they are not gaining weight and all that. All right, thank you so much. I think I'll just round up with those on Instagram, and then we can close it for today. I think I'm not doing too bad for today. We're going over time. Okay, I think I know where I stopped now. Grace is saying my baby is 5. Okay, no, I've answered that one. No, please don't give your 5-month-old egg. Wait until they're 6 months old. There's no hurry. Chef Girl says, my husband is treating pneumonia. Can my child contact it? It's possible, because it's something that can get through the hair. It's not from drinking water, it's through hair. He's breathing. If your husband is coughing out and all that, children can catch is through the hair. So keep them as much as possible away from each other. Let your husband wear face masks and all that. Just the same way you do with COVID. Just try and maintain limits their contact. My baby has rashes on the neck. I've used pseudo cream. Okay, pseudo cream is not a treatment for skin rashes. Pseudo cream is just to prevent nappy rashes. So if your baby has neck rashes, you need to see a doctor. We need to know what is the rash, what is the cause of the rash, and then we will tell you what to do. We don't just say go and use something. That's the problem. Most mothers just say, what could I use? And somebody will say, go and use this, go and use that. They don't know what is causing the rash. They don't know what kind of rash it is. And then you will keep using different things, and then you say, well, nothing is working. It's best to know what it is from the beginning before you just start using. Avoid that temptation to always just want to use something, So please go through our website, read about the skin care for babies, so you understand. Sometimes correcting what you are not doing right may be the solution to the rashes. But if the rashes is not infection, there's a way we treat it. And we don't just say use pseudo cream, I can't just tell you what to use. I've not even seen the rashes. That's not how doctors work, but I know that's how other experienced mothers work. They just tell you what to use even without seeing anything. It's a very wrong and very dangerous way to do things. You can use shea butter for baby. It's not compulsory. There are so many other what we call hypoallergenic products. In other words, just products that are not having too much chemicals that babies are not going to react to. So olive oil, Vaseline, the blue seal one without perfume, your coconut oil. These are products that you can use on the skin, and they are not going to give your baby the baby are not likely to react to them. That's what we meant by hypoallergenic. Chef girl saying my 4-year-old has lymph nodes around the neck, is paining him. Should you be worried? It is normal to have lymph nodes, but lymph nodes should not be paining you. So if your lymph node is paining, it means there's some infection or something, and definitely you need to see a doctor to treat that. So what is the difference between catarrh and adenoids? They are not the same thing at all. Like they are poles apart. So catarrh is when your baby is having like a running nose, like mucus flowing down the nose. That's what we meant by catarrh. Adenoid is a particular structure in the body called adenoids. It's as close to the tonsils. They are around the entry into the airway, so they can get bigger, and when they get big, that is when they cause obstruction to the airway, because they are the entrance to the airway. So if it is too big, it will block the airway, not allow air to go down properly, and usually sometimes they can also get infected. So what the ENT doctors do, if it's too big and it's causing problem, is go and take it out. That is adenoids. That is not catarrh, which is just like nasal discharge or something like that. So they are not like related at all. Of course, the baby who has adenoid, when they have infection, they can have nasal discharge and all that, but they can have adenoid without having catarrh at all. My baby is 2 years old, can't chew food. She only swallow. Yeah, it's an habit. Some children don't like to chew, but you should encourage them to chew. If you have access to occupational therapists or speech therapists, they can give you some like exercises or how to get, because your baby need to chew, but in the meantime, you need to really make sure you cut the food very small and all that, so that baby does not choke on them. But you want to encourage them to chew. Why does my 4-month-old itch his face from time to time? I don't know. Maybe the cream you're using on the face maybe the child is reacting to something. There are many reasons why your baby could be itching. So without seeing your child, without knowing whether there's some rashes on the face, whether you're using a product that the child is sensitive to, without having all those background information, I will not be able to say what exactly is making your own baby to do that. So that's what I mean by I don't know. Joffisy, my husband is diabetic, his mom is few nieces. Yes. I feel it's hereditary. Yes, diabetic is hereditary. Is there any way I can prevent or rather protect my 4-month-old? Your 5-month-old may not necessarily have diabetes, but your 5-month-old may have the tendency to become diabetic maybe in future, depending on the type that they have in the family. I'm not sure there's anything you can do to prevent it, but good, making sure they eat healthy, making sure you're monitoring, exercise and all that. But if you have a genetic tendency, it may be difficult to be 100% able to prevent it. So, but you can just make sure it doesn't, you just do basic protection. Okay, question in my question box, Latika saying, my doctor will be 5 years next week. She throws up sometimes after dinner and I'm getting bothered. Yes, why should she be throwing up after dinner? Is it that she has overate? Is the food too much, or she doesn't like the food, or is she, so you may need to see a doctor to know why. Have you dewormed recently? Those are the kind of triage question I will ask first to know what it is. And so you can try and figure it out as well. Is it with all food? Or is there any particular food? What time do you eat dinner? Are you eating so late in the night? So sometimes children can have indigestion because they eat so late and all that. So you need to watch out. So simple advice: eat early, around 6 p.m., 7 p.m. max. They should have eaten dinner. Dinner should not be too heavy, should be light. And if it's a food she doesn't like, there's really no point giving her if she's going to vomit it. Make sure the food is warm, not cold, irritating, or those kind of things. Make sure the child is the warm every 6 months. So sort out those basic things and then see whether it solves all the problem or not. Then, of course, if it doesn't solve it, you have to see my colleagues in the hospital and see, well, my 17-month-old baby is not yet talking, saying, Mama, anything I could do to help or leave her. She's yet to start school. Yeah, 17 months old should not be in school. Your 17-month-old should be saying at least 3 words, 1 to 3 words. I would rather say there are lots of speech therapy tips for parents, or if you go to our Facebook group, we have one in our guide section. There are things you should be doing with the baby, playing with the baby, trying to stimulate their language development. I would not say just leave the baby. But I'm not saying you should be worried as well, but there are things you can still be doing with the child to kind of support the child in terms of his language development. So, and then watch. If by 2 years there's not much different, you need to see a speech therapist. They will be one to see you. My 15-month-old still refuses to eat, just sucks all day. Yeah, you should be worried if your 15-month-old is not eating, because sucking is not going to be enough for your 15-month-old. Your 15-month-old is going to lose weight, is going to have malnutrition, because your 15-month-old should be eating more than breast milk. So you really need we have a lot of tips on how to go about doing complementary feeding and all that so that your baby can eat, and you need to get into that. So you may go through our group, or you can see a dietitian as well. They can also help you with tips on how to get your baby to eat. Okay, I think I've done all the questions that have come in before 7 p.m. So if you still have any questions, please, you can go to our Facebook group from Monday to Saturdays. It's 24 hours every day. You can drop your questions there and we'll be able to answer it. For those of you on Instagram, I'm sorry, we don't do DM questions. We don't do on our group. I know some of you always tag us to all the random questions people post on Instagram, but we don't answer that questions that way. It has a reason why we don't, because we believe that when it comes to rights of children, it is not a democracy of opinion where people just drop anything. It's better to get it right than to have 100 of things to sift through and go and pick the wrong thing, because that's what most people favor. It's a very dangerous thing when your health of your child should not be something for every random person to tell you what to do. You need to make sure you are speaking to professionals, health professionals, because if you mess up your clothes, you mess up your car, you can get another one. If anything happens to your child, that's it. And I think your child is worth more than your car, worth more than your clothes. So please don't seek advice from fellow mothers when it comes to health issues. No offense to fellow mothers, but we don't want our children dying because of wrong information. And a lot of people don't, they meant well sincerely, but they could be wrong, even though they are sincerely they are being sincere in their advice as well. So please, 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 please get information from health professional when it comes to health of your children. Don't leave it to chances. So that is why we provide a platform for you to get questions answered by the health professionals. So you can ask your question, ask the pediatrician's Facebook group from Mondays to Saturdays, and we will answer your question. We answer thousands of questions every week, and I think it's very helpful. But of course, you can always join us again every Monday on Instagram, YouTube, Facebook, and we also answer questions live like this. And if you have any questions, you can always post on our group. You can also post on our website. And of course, you can join us for ATP Live. So thank you so much, everybody, for joining me this evening. And I will see you again, same time next week. Of course, we'll go on break in December, but I'll let you know more about that. But so bye for now. Thank you.